most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to self-treat pain on the side of your hip. Now, this could be if you're diagnosed with Trochanteric Bursitis or Gluteal Tendinopathy. We just did a video on this, trying to help diagnose it. The problem is they both present the same way. Luckily, they're also treated the same way, and that's what we're going to show you today.
Right.
So we got some treatment suggestions first, and then we're going to do some treatment exercises.
Sure.
So suggestion number one, you want to avoid repetitive stress. So like if you're maybe biking, or what would be also be repetitive? Probably
Walking.
just running. Yeah.
Yeah. I mean, you'll know because as you do it, it hurts while you're doing it, or after you get done, it's like it flares it up. And, and you wonder why, and think, well, what was I just doing before that? Maybe you walked half a mile, or you went up and down a lot of stairs.
And in that case, maybe you're going to need to use a cane. And take some stress off the hip for a while.
Right.
And I know all of you out there, I can hear them saying already, a lot of them don't want to use a cane or a
Not
walker.
going there.
But, you only use it for a while till it calms down.
Mm-hmm.
So listen to us. All right. Number two, if you actually have one leg longer than the other, and some of you know this already, you may have been told, you want to correct that, because when you have a shorter leg, I don't know, and Brad and I were talking about this, it could be a longer leg or a shorter leg, but but usually the more stress is on the shorter leg.
Yep.
I think with walking, like you said, it could be on the longer one.
This one is one of those things that's hard to do as a layperson. It's not easy to do as a therapist or a doctor too. How do you address it? Is it is it a posture thing? Is it in the pelvis?
Right. Is it a real thing? Because sometimes certain health care providers I know will have you lie down, flat on your back, and if you have your hip shifted, it looks like one leg's longer than the other.
Right.
So
I've had people that were diagnosed with a leg length difference, and I thought it was. I'd give them an insert in one shoe, and it wouldn't make a difference. I mean, sometimes it would, sometimes it wouldn't. It's not as clear cut as it seems that it should be.
Yeah, it is an easy correction, though. So on the short side, you could just take a piece of carpet and cut out in the shape of a heel. And
go to your carpet and...
Well, if you have some laying around.
Right, yeah. I've used little rubber pads. I've put cardboard and...
Oh, yeah,
put
cardboard.
It up on top.
There you go.
You cut it out to put in there, but... Carpet's good, though, Bob.
I like cardboard because you can do layers then.
Right.
You can keep layering it up until, and then try it. If it feels better, it works, great. If not, forget it.
You take it out, yep.
The other thing is you want to make sure you're standing correctly, especially if you stand a lot, like on a job or whatever. You don't want to be leaning on one side the whole time. And a lot of people do that.
And they're not even aware of it.
They're not even aware of it. Right. And, there's a way you can actually... When you lean on one side, what you're doing is you're straightening that knee. Mm-hmm. You're actually hyperextending it sometimes. You can actually take tape and put a piece of tape, run it from the back of your thigh down to your calf, and tape it when your knee is bent. And then when you stand and try to straighten it, it'll pull. So it'll remind you that, no, don't do that. Yeah. And if you have trouble breaking the habit, you could try that. You also want to sit correctly. And I'm guilty of this one. I don't know why, but when I eat at my kitchen counter, I have a stool, and for some reason, it's just more comfortable for me to be on one side.
Sure.
And it's not a good thing if you're having either one of these problems to be doing it. It's just,
This is a really bad habit.
Yeah.
It's hard on the knee. It's hard on the tilts your hip. It puts stress on your back. And some people have been doing it for years. And I think as you get older, that could catch up with you.
That all catches up to you. Muscles shorten. That shouldn't be. Muscles lengthen. That shouldn't be.
Yeah.
And they start causing pain. All right. You want to sleep correctly. You really want to avoid sleeping on the painful side.
Right.
But if you're not sleeping on the painful side, let's say you're sleeping on the non-painful side, you still got to make a correction here, because if you lie down and your painful hip is right here, and you do something like this, or even like this, there's stress on it.
Right.
So you want to get a pillow in between the knees, and that levels it out and takes stress off the hip all night long.
And most people you put that pillow and you say, "Oh yeah, that does feel better."
Yeah,
But
right.
then you don't have a pillow for your head.
Well, you got to have another pillow.
Get another pillow. Take it from your wife,
Yeah.
or whoever.
Yeah, you'll find out. I actually use a kind of a different pillow because it gets
one made
warm.
for that?
Yeah, it's kind of made for it.
Yeah.
Yep. All right. Next one. Use a cane in the opposite hand, which we kind of alluded to when we talked about with walking.
So here's my painful hip. I'm going to use it in my left hand, and that'll take. There's that show, that doctor show where he's got a painful
the
right leg,
doctor.
and he's a doctor and he doesn't know how to use his cane.
Dr. House.
Dr. House, that poor guy.
Yeah. But so you want to use it on opposite side, but biomechanically, physics-wise, it works better.
Yep.
It takes more stress off the hip.
No doubt about
and
it.
you'll walk with less of a limp.
Yep.
And again, we emphasize again, if you need it, use it. All right, now we're going to go to some of the treatment exercises. This is a progression. We're going to start with just strengthening without movement, which is isometric strengthening.
Right.
So we're going to need a belt. Do you have the belt, Brad?
Oh yeah, we've got one right here, Bob.
So Brad's going to put a belt on around his thighs, and he's going to start in bed. He's actually going to lay down flat on his back, and he's going to work on spreading his legs out, but the belt will stop him from doing so.
So just put that belt through this.
And that strengthens.
Above the knees would probably be the best location for this belt.
Yeah. And yeah, you can do it with your legs bent, or you can do it with your legs straight,
So
whichever works. Yep.
So I'm pushing out. The belt simply just locks your knees in, so you get that isometric strengthening
There you go,
on your
Brad.
hips. Oh, thank you. We could start here. It's going to work a little different fibers of the hip.
That's exactly it. Will you're going to get both fibers if you do it with bent and straight.
I usually do my isometrics about 5, 6 seconds. Counting my head 1,000.
And I'll do 10 reps.
Yep.
Yep.
So if this hurts down here, but it feels good here, I would go up to here and do it here. When you're standing, your hips are straight, so this would probably be a little more functional.
Yeah, you don't want to flare up the hip,
No.
but you can control with how much stress you put on it, and put on how much it can tolerate. If it can tolerate a full pull, go ahead and you let it rip.
Yeah, push as hard as you can. If you put your fingers right here above your hip, you'll feel those muscles kick in very clearly, and that gives you some good feedback.
Gives you some motivation. Brad, you can stand up, and actually the next one is you actually can do that standing. Now you probably need to hang on to something.
Yeah, now this is going to fall down, so just, don't use the belt. I'm going to hold on to this for balance. I'm going to work my left leg.
It's supposed to be isometric. Oh, you're going to push against something.
Yeah. I'm going to push against, a sturdy table leg.
Leave it to Brad right away. He's got to come up with an improvement.
Good part. Well, that was kind of hard to hold.
Yeah, I understand
So
that.
I'm going to push and relax. You can have a chair over here. You may, if your balance is good enough.
Yeah, you could go up against the wall.
Yeah,
and push against it that way.
Sure, right here.
Yep.
If you push through the wall, you're really strong.
All right, the next one is called the reverse clamshell. Now, some of you may have heard of the clamshell, which is actually, you look like a clam. You move it like, but now these two muscles, two of them that are involved, and the bursa too, it really doesn't affect the bursa, but it's gluteal tendinopathy. There's the gluteus medius, gluteus minimus, and they are internal rotators. One of them does both, but they turn the hip in like this.
Yep. So the femur goes this way, so watch his foot goes up. The knees are staying together.
Yep.
Now the clamshell does just the opposite, where the feet stay together. But they're both working, so that it's a nice exercise because they complement each other, the clamshell and the reverse.
Yeah, this actually gets the glute max better because that's an external rotator. So you're going to start off with putting your knees together and lifting up your heel on just one side, and that's how you're going to progress this. You're going to start off with that. And
how high you can lift your foot is going to vary from person to person.
Some of you might not have much motion there.
Right.
And some of you may have a lot. So we're going to have you do that 10 times. Boy, it's funny, Brad. You
feel that, don't you?
It seems like nothing, but you start to feel it after when you get up to that 10. All right, the advance from there is these muscles also abduct the hip. They bring the hip up like that.
Right.
So now you're going to do both. You're going to do hip abduction and you're going to do internal rotation.
So he's got this gap in here, which is working a muscle.
I've never done these before, so I had to.
This is a coordination.
Yeah,
thing,
it is a little coordination.
If you have problems doing it, you're not the only one.
And believe me, you feel that one faster.
Sure.
So, and then it gets some different fibers. You actually can do it in extension. Am I out of the way?
Yep. Don't worry.
So you're going to bring the hip back, and then you're going to flip turn it inside or turn it internal rotation.
So the knee goes this way.
Yeah, I'd go back further if I wasn't.
These are, if you're not doing this, or if you're elderly or you haven't done a lot of exercise, these are going to be a little challenging.
Yeah, here's the advanced one then, Brad. The final one that you'll work up to is you can do a plank, a side-lying plank, and you can start on your knees, and then you're going to try to do hip abduction while you're doing it.
Here, Bob, can you do that without your hand there so people can see? Yeah, so this is gap here. He's got this hip up. So he's working both hip abductors.
Yeah, this one below is really working hard right now. And then if you get real advanced, am I going to go off the mat here? Then you
Get rid of that pillow, Bob.
Oh, geez.
If you're at this level, you're probably a younger person.
Yeah, you're probably
or a very fit senior.
Yep, there you go. So there you go. 10 times on each one of those. You can do them probably, I'd say every other day. I wouldn't do them every day.
Yeah, until you get stronger. You got to listen to your body. If you're sore, you just did them the first time, you're sore the next day, take that day off, wait till the next day for sure.
Because you're trying to build up muscle, not make it worse.
Right, you don't want to get things flared up. Bob, are we going to mention this?
Yeah, sure.
PDF?
Yeah, this is this video, by the way, is a part of a series of videos on hip pain. So if you're interested in seeing those, it's a free series. Go to bobandbrad.com, go to the program section, and look for hip pain. And under hip pain, you're going to find a whole bunch of videos.
All about the hip. Go to the title that fits your need.
Pick the title that you want to watch. You don't have to watch every one. And then with each video, we also have
a printout, which is a review of the whole video with the exercises and whatnot. So you can take that and use it for a review later on with the video off. It's all free. You don't need your email. It's just a heck of a deal.
Yeah, we're giving people.
Yeah.
So, all right.
It really is.
All right. Thanks for watching.